Today we're talking about portal hypertension, when the pressure rises.
So, deep inside your body, there's this silent pressure building. Now, most of the time, that's totally fine. But when it's not, the results can be, well, catastrophic. And look, we're not talking about the kind of blood pressure you get checked in your arm at the doctor's office. Nope. This is about a critical, super high volume system all centered around one of your most vital organs, the liver. When the pressure here gets cranked up too high, it kicks off a really dangerous chain reaction.
Okay, so to really get a handle on what goes wrong here, we first have to look at how this incredible system is supposed to work, how it works perfectly day in and day out. Let's dive into the liver's vital blood highway.
You know, your liver is pretty special. It's got this dual blood supply, which you don't see everywhere. On one hand, it gets oxygen-rich blood from the hepatic artery, just like most other organs. But here's the critical part. It also gets a massive flow of nutrient-rich blood coming straight from your entire digestive system. We're talking your intestines, your spleen, your pancreas, all of it flows through this huge vessel called the hepatic portal vein. Think of it like a superhighway that brings everything you just ate and drank right to the liver's front door for processing, detoxing, and storage.
And when I say massive, I mean it. This portal vein isn't just some small side street. It's delivering about a liter of blood every single minute. That's the full 2/3 of all the blood the liver gets. The hepatic artery, it only handles the last third. So the main takeaway here is that this portal system is a super high volume, absolutely essential pathway. It's a big deal.
Right, so what happens when that superhighway suddenly has a major traffic jam? It's like someone just built a giant dam across a powerful, fast-flowing river. The pressure upstream just builds and builds, and all that backed up water, well, it has to find somewhere else to go.
And that, right there, is exactly what portal hypertension is. It's not really a disease on its own, but it's this dangerous state of abnormally high pressure, specifically inside that portal vein system we were just looking at.
So in a healthy person, the pressure in this whole system is surprisingly low, right? We're talking around 7 millimeters of mercury. Everything's just flowing along smoothly, no strain at all. But when that pressure spikes up past 20 millimeters of mercury, boom, that's the definition of portal hypertension. We're talking nearly a 3 times increase in pressure. The system just was not built to handle that kind of force.
So where exactly can this dam pop up? Well, doctors basically group the causes into 3 main locations, all based on where they are in relation to the liver. The blockage can happen before the blood even gets to the liver, inside the liver itself, or after the blood has already passed through. Let's break that down.
First up, we have prehepatic causes. Pre meaning before. This is when that main highway, the portal vein itself, gets blocked before it can even reach the liver. The most common reason for this? A blood clot, what we call a thrombosis, forming right inside the vein. And this can be kicked off by all sorts of things, even a bad infection in a newborn's umbilical cord. Next, and this is the big one, by far the most common, are intrahepatic causes. Intra, meaning inside. The problem is literally inside the liver, and the number one culprit, you've probably heard of it, liver cirrhosis. What happens here is healthy liver tissue gets replaced by hard, unyielding scar tissue. This scarring actually squeezes shut the thousands of tiny blood vessels inside the liver, creating this huge amount of resistance. It's like having thousands of little dams all throughout the organ.
And finally, you have your posthepatic causes. Post meaning after. In this case, the liver itself might be totally fine, but the drainage system on the other side is blocked. So blood gets through the liver, but it can't get out properly. This can happen because of clots in the veins that drain the liver. That's a rare condition called Budd-Chiari syndrome. Or it can even be caused by serious right-sided heart failure, where the heart is just too weak to pump the blood that's coming back to it.
So look, it doesn't matter where that dam is, before, during, or after the liver. The result is always the same, a massive, relentless buildup of pressure. And the body, in this desperate attempt to just survive, starts creating its own detours. But here's the thing, these emergency bypasses are fragile, they're makeshift, and they are incredibly dangerous.
This constant high pressure leads to what you could call a flood of consequences. For one, the spleen, which drains right into this portal system, gets totally engorged with backed up blood and just swells up. That's called splenomegaly. Then, the pressure can get so high it actually forces fluid to leak out of the blood vessels right into the abdomen. That fluid buildup is known as ascites. And most critically, the body starts creating those new pathways we mentioned, these collateral veins, to try and bypass the liver altogether.
So that leads us to the million-dollar question, right? With the main superhighway totally blocked, where does all that backed up blood go? A whole liter of it, every minute. It's got to force its way back to the heart somehow, through any tiny little path it can possibly find. And wow, this right here shows one of the absolute most dangerous detours. All that backed up blood has to reroute itself through these tiny, fragile little veins at the bottom of the esophagus. I mean, these veins were never designed to handle this kind of high-pressure flow, so they swell up, they bulge out, and they become what doctors call esophageal varices. The diagram on the left gives you the idea, but that endoscopic image on the right, that shows you the terrifying reality. These are basically ticking time bombs right inside the body.
And it's not just the esophagus. These dangerous detours can pop up in other places too, like in the lower rectum. They can even form on the surface of the abdomen. When they show up around the belly button, they can create this really visible, radiating pattern of swollen veins on the skin. It's a sign called caput medusae. Yeah, named after the monster from Greek mythology. You know, because this whole condition is so quiet until things get catastrophic, figuring it out is a lot like a detective story. Doctors have to piece together all these little clues to find the hidden pressure, figure out what's causing it, and, most importantly, map out all those dangerous consequences we've been talking about.
So the whole investigation really has three main goals. Goal number one, check the liver's health, since that's so often where the problem starts. Goal number two, and this is a huge priority, find out if those dangerous esophageal varices have actually formed. And goal three, try to pinpoint the exact root cause of all that high pressure. So how in the world do you find these hidden varices? Well, the gold standard, the best tool they have, is an upper endoscopy. It's a flexible tube with a camera on the end that's passed down the patient's throat to get a direct look at those veins. This lets doctors see not just if varices are there, but also how big they are and if they look like they're at high risk of bursting.
The second you find those varices, the whole focus shifts immediately to management. See, the goal isn't always to cure the underlying cause. That can be really tough. The goal is to get that pressure under control and, critically, to prevent a catastrophic bleed before it has a chance to happen.
The treatment plan really depends entirely on the situation. Let's say a patient has varices, but they haven't bled yet. The goal is simple: prevention. That means using things like beta blocker medications to lower the pressure in the whole system, or a procedure called banding, where doctors go in with the endoscope and put tiny little elastic bands around the varices to basically choke them off. Now, if a patient is actively bleeding, that's a completely different story. It's a life or death emergency. Priority number one is resuscitation, to get them stable. Then it's an emergency endoscopy to find the bleeder and stop it, either by banding it or injecting it with something to make it clot.
And this number right here, this is why everything is so aggressive. The mortality rate from a first-time bleed from one of these varices is a staggering 50%. 50! It's one of the deadliest emergencies in all of medicine. This isn't just some complication, it's literally a coin toss for survival. And that's why the entire focus of modern medicine is to prevent that first bleed from ever happening. When you really think about it, portal hypertension is just this powerful lesson in cause and effect inside our bodies. It shows how a problem in one single central organ, the liver, can create these devastating ripple effects through a hidden network of connections we just don't think about day to day. It's a pretty stark reminder, right? Our organs are resilient, for sure, but they are all part of this deeply interconnected system where the failure of one tiny part can put the whole thing at risk.